This video is intended to clarify some of the misconceptions about semaglutide and emphasize its benefits. And I want to start off by saying, that there is no surrogate, there is no replacement for following a proper diet and maintaining a healthy exercise regimen. It's easy to look for the simple solution like medications. The reality of achieving lasting metabolic health is far more complex. Ways to integrate FDA-approved medications like semaglutide is to seek the advisement of a competent clinician that can help guide your weight loss journey. Maybe you might want to talk with us over here at Althera and see if there's something that we can add to what you're already doing to improve your results. Understanding the impact on digestion and the dietary sensitivity of medications like semaglutide is important. It's common to experience things like nausea and loose stools or diarrhea. By delaying gastric emptying, semaglutide allows you to feel fuller faster, and frankly, you feel fuller longer. And that helps to manage your appetite effectively. If you're full down here, you're less likely to be putting in more food up top. This slower digestive process also impacts how your brain perceives hunger and the fullness signals, and it gradually encourages the development of healthier eating habits. So as your body adapts to this change, you may become more sensitive to what you eat and drink. So this reaction in your body is a way of signaling that food and drinks that contribute to your health are sometimes no longer tolerable, and they push you towards making healthier dietary choices. As your body becomes more and more acquainted with these molecules, again, I think that you're learning some new things, and that heightened awareness of how the different foods affect your body is a crucial step into changing that overall those overall health behaviors and improving your overall health. Pancreas is an organ that sits in the front and center of your gut. Pancreas is important for production of insulin. The fact that semaglutide has been reported in literature to increase the risk of pancreatitis basically has heightened persons concerned on its use. Therefore, a complete and honest disclosure on your medical history is certainly important when you come in to see us. Semaglutide is much more than a weight loss drug. It's a powerful tool for improving metabolic health. Users of semaglutide often experience significant improvements in their lipid profile and their cholesterol. And again, these are things that contribute to a better quality of life. Like any medication, using something like semaglutide involves weighing the potential risks and benefits. Let's talk a little bit about addressing concerns like kidney failure and thyroid tumors while on semaglutide. Concerns about kidney failure with semaglutide are often attributed to inadequate hydration. So it's essential that you maintain proper fluid intake while you're on this treatment. Thyroid tumors, specific details from animal studies have led to some misconceptions. During the preclinical trials on these drugs, thyroid tumor was observed, I think it was in just one subject mouse. However, it's crucial to note that these findings have not translated into any known human cases. One last little thing to talk about with regards to use of semaglutide and medications for weight loss is their effect on libido. It's important to clarify that lack of libido is not recognized as a side effect of semaglutide, and according to the clinical studies, one other thing that I think is super important to talk about on semaglutide, that I've seen is that patients utilizing this particular drug are experiencing tremendous weight loss. Medications like semaglutide have been a tremendous tool in our new toolbox of therapies here at Althera.